Hi there. My name is Sheldon McLeod. This is Thinking Out Loud, presented to you here exclusively on the SaltWire network. And again, we invite you to search out our new YouTube channel and subscribe to it and like the videos, comment, leave your thoughts, share them with your friends and family. Lots of stories out there. And, I'm of an age where I can remember, it wasn't that long ago, you could go to the pharmacy and pick up a pack of smokes. Now, obviously, things have changed with smoking in our society and the acceptance of it as a social norm. But one of the other things that's evolved for pharmacies is the idea that it's more than just a place to pick up a prescription. There are times that your pharmacist can help you out. No better example than what we've just gone through with COVID-19 and the vaccinations, or even the migration of influenza shots to your local pharmacy, because pharmacies are in every community. There's a church, Chinese food restaurant, and a pharmacy pretty much everywhere in Nova Scotia. And this story came about because of, for one thing, a news release from Nova Scotia's Liberal Party looking at ways to extend the services pharmacies are providing to alleviate healthcare pressures in Nova Scotia. Allison Bodnar is the CEO of the Pharmacy Association of Nova Scotia. And you represent, about 1,200 pharmacists in Nova Scotia?
Yeah, we represent pharmacists, pharmacy technicians, and pharmacies across Nova Scotia.
And the idea that things have evolved, things have changed. How have things changed in your lifetime since you've been involved with the pharmaceutical industry?
Yeah, I think people don't truly understand the extent of the skill of our pharmacy professionals. So the scope of practice that people are talking about in the news over the last couple of days is actually not a new scope of practice for pharmacy. Pharmacy has been trained in these expanded scope services since 2001, and they actually became part of our legal scope of practice in 2011. So it's been a full 12 years that these services have been available. Unfortunately, for the most part, they've been a fee for service because they haven't been funded as part of our public health system. So that started to change a few years ago. In 2019, we added prescription renewals, which has been a phenomenal service for patients. And yet, even 3 years later, most people don't know they can have their prescription renewed for up to a full year at a pharmacy, right? So there's a lot of a lack of awareness. But, so pharmacists can renew prescriptions. We did almost 200,000 of those in the last fiscal year. We can manage contraception. So, young women can go to their pharmacy and have an assessment and get their contraception. Herpes zoster, urinary tract infections. These are services that are already funded and have been having a huge impact on the system. Minor ailments, though, is one area where pharmacists have a very large scope of practice. We can assess and prescribe for up to 31 different minor ailments in Nova Scotia. So the broadest scope of minor ailments, assessing and prescribing outside of Alberta. But it's never been funded. We've worked over the years since 2011 to have it funded. And it just, whatever it is, government has priorities over the years. But I think there's a lot of interest now because we see the state of the system, and we've learned through COVID what an incredible healthcare asset our pharmacy teams are. So whether that's the pharmacists and pharmacy technicians providing, over 2 million immunizations in the last couple of years, or it's the pharmacy team providing prescribing and renewal services for patients who had nowhere else to go during the pandemic, all of a sudden everybody's eyes are open to what pharmacy can do. And we're seeing it in other provinces. So we saw PEI provide funding for all, they have the same 31 minor ailments, provide funding for all of that in December. A lot of fanfare over Ontario, just introducing both the scope, so they didn't even have the legal scope, but they introduced the scope and the funding for 13 minor ailments on January 1. We're seeing it in BC, and we're seeing it around the country. So I think it's forcing governments to look at, where are our capable healthcare providers and how do we reimagine using the ones that are here now on our soil, ready to do stuff. And that's where pharmacy is. This isn't a new practice for us. We've been doing this for a long time. The issue is it's been a fee for service. So those who can pay, and those who can't, unfortunately, don't get the service. And that just creates more inequities in our healthcare system that we think should be avoided through the public funding of these services.
And if I were to ask you why you feel perhaps governments haven't done this, haven't gone down that path to allow you to use your health card in order to pay for these services that would be covered if you were waiting in line at a walk-in clinic or you went to an emergency department. I know it's going to be speculation, but Zach Churchill was at his last government posting a minister of health. And now he's saying this is something that needs to change. So something has changed with him, and not to get political, but why do you feel that there's some reluctance to engage in that way to change the system to allow that to happen?
That's a really tough question to answer, because I think it starts with people always had a preconception of what happened at a pharmacy. I mean, most people, including politicians' experience was picking up a prescription and never really thinking about what that meant, right? I mean, we use the joke that, taking it from the big bottle and putting it into the little bottle. That is nothing to do with what a pharmacy practice. Even if we're just talking about dispensing, that pharmacist is ensuring that medication is right for you, given your medical conditions and history and everything else that's going on. They have the legal obligation to ensure that's the case. And if they don't feel it is, they actually have the legal obligation not to fill it. It's not an order. They're not being told to do X by a physician. Their job is to make sure it's the right medication. And that is an incredibly important role. Pharmacists are the drug therapy expert. They receive more education in drugs and their impact on the body than any other healthcare professional. And we need, as a society, to use that skill set to the full advantage. But most people have never understood it. And if you never understood it, it's hard to imagine why we'd want to go down that road. And then secondly, the healthcare system wasn't in the state it is today 10 years ago, 5 years ago, right? We are in a place today where systems that were designed 30, 40 years ago simply aren't working anymore. And we need to collectively work to find a better system, one that embraces technology, one that embraces serving the customers in the way they want to be served. And looking to all healthcare providers to work to their fullest of scope.
I know you mentioned there are services you can offer that people aren't even aware of, and Pharmacy Association of Nova Scotia has done a great job of putting out information, putting out ads, trying to get that in front of folks. So, Allison, what is the biggest takeaway for people watching or listening to this right now about what it is that they could be missing out on if they're not using the pharmacist to their full scope of capacity?
Yeah, I think people should really think about the role of the drug expert. And if you are a patient that has a chronic health condition, think about how you can work with your pharmacist to manage that drug therapy. They can work with you, put a plan in place, and help you to achieve the goals that you want as an individual. Maybe it's getting down on the ground with your grandchildren and being able to play again. Whatever that is, maybe it's running a marathon again, right? Whatever it is for you, the benefit of the pharmacist that knows you and knows the drug therapy, they can really work with you to achieve those goals. And so what we need to do as an association is how do we enable pharmacists to do that through the proper funding mechanisms so that they can actually use their skill set to the advantage of Nova Scotians. So again, whether it's chronic disease, drug therapy management, your immunizations, look, you can go get, if you get shingles, you can have your shingles treatment there. If you have a urinary tract infection, you can go there rather than sitting in an ER for the next 12 to 24 hours, right? If you have a minor ailment, yes, it's not paid for today, but if you don't want to sit in an ER for 7 or 8 hours, maybe it's worth the assessment fee for you today. But I encourage everyone to think and learn more about what the role of that pharmacist is and the pharmacy team as experts in pharmacotherapy and how they can really add to your healthcare in Nova Scotia.
And not to ask for people to lobby on your behalf, but I think it would go a long way if each and every one of us went to our MLA or sent a note to our MLA saying, why can't I, or ask the question, why can't I use my MSI card if I'm getting a prescription refilled just because it happens to be at a pharmacy and not at my doctor's office? Because that on the surface, it doesn't make any sense.
Yeah, and I agree with you. It always carries more weight when citizens bring those concerns to politicians. And, it's always been a point of ours to say, look, if it's within our legal scope and you're paying some providers to provide the service, you should pay all providers who have that within their legal scope. It's better for the system. It's better for access. As you pointed out, we have almost 320 pharmacies around every community in Nova Scotia that are open more hours than most other healthcare professionals, and utilize that. I mean, pharmacy's evolving too, right? If pharmacies, and we hear that on the flip side. Well, now I have to make an appointment, or I have to wait longer, right? There's a negative to evolution as well, and that's some of what we're going through in some of the campaigns that we've done recently. Is ask your pharmacist how you can work with them to make your wait times less, right? We have lots of automated refill options. We can call ahead. There's texting options. There's booking an appointment. So things are evolving in pharmacy as well, and we always know evolution's a bit bumpy as we get from one place to a better place, but we really believe that pharmacists have the skill set and the sort of structural capacity around the province to be able to really help with the issues we're seeing in healthcare today.
And as you said, other jurisdictions are moving forward with those types of initiatives. Do we have to wait to see how it's working, or can we just assume it's going to work because it's working in other ways in other areas of healthcare?
Yeah, and I think what I'm saying here is we have been leaders in this province, and I don't want to discount that. So we have a community anticoagulation project in pharmacy, which basically means if you're on warfarin, you know that it requires a lot of monthly testing and adapting your prescription, and that's a lot of trips to a lot of different places, right? Your doctor, then the lab, then the pharmacy, and you just keep making that. Well, we have a service now that's fully funded in Nova Scotia where you can go into the pharmacy, have your test done in the pharmacy, and within 10 minutes, you have your prescription adjusted and you're out the door. And that's a fully funded service in Nova Scotia. That's groundbreaking in Canada. We are one of the first provinces to fund renewals. Have we got it perfectly right? Probably not, but we are providing renewals, and we are one of the first provinces to do that. Yeah, we're a bit behind the 8 ball on some of the other things, minor ailments and chronic disease therapy management, but hopefully, the experience we have to date, we'll get there. We'll get there soon. We'd be the first people to get our pharmacies up and ready to go with minor ailments as a fully funded service, because we know they're already doing it. Right? It's not a new scope for us. We don't have to do training. We don't have to do changes to workflow. This is something that pharmacies are used to and are doing already. And so it's really a matter of funding and just getting pharmacies going.
Is it getting frustrating that you've been repeating some of the same messages over and over and over, and yet the movement is slow? The advancement of those things is a little bit slower than perhaps you'd like.
I think I've been in it too long to be frustrated. I've worked with governments for a really long time, and there's a pace to evolution, and it differs depending on which industry you're in. But would I have liked this all to happen in 2011 when we were given the authorization to do all this? Absolutely. Do I understand that there's realities with, as I said, perception and fiscal realities which evolve over time? I get that, right? And now we're in a position, though, where I think all the stars kind of align in the sense of people are now, they actually understand a bit more about what pharmacy does. They see personally or feeling the need for something to change. And financially, we can't keep paying for the old system. Like even if there were 1 million doctors sitting at the border, our healthcare system would collapse under that weight, right? We have to find more efficient, more effective ways of delivering healthcare so that each participant in that, so whether that's a nurse practitioner, a physician, a specialist physician, a pharmacist, an emergency technician, whomever we're talking about, what we want to do is enable them to be able to work to provide the most value to the system, and then we need to support it with infrastructure that allows them to do that in an effective way, and that's where we have a lot of work to do. I think the willingness by all the providers to work hard is there, and they want to contribute and they want to do the best by their patients. But we need to put the systems in place to make that happen.
And there's no question people are seeing a crisis in healthcare, and if anything can be done to help alleviate some of those pressures, why wouldn't we take those steps now as opposed to wait until it gets worse?
Yeah, exactly.
The CEO of the Pharmacy Association of Nova Scotia, Allison Bodnar, thank you again for your time. I really appreciate it.
Yeah, thank you.